And now for another of our poster presentations, or poster heroes, I should say. And this particular hero is Jose Bartelt-Hofer from France via Mexico and Germany. But you're an economist, so we don't have many economists sitting on the sofa, but here we are. So you've done some modeling. Tell us a bit about that.
Yes, what we are seeing in clinical trials for diabetes, which are quite expensive, is that we are not able to see what's going to happen to the patients in the future, since the time horizon is usually very short. And what we also see is that clinical trials don't incorporate all competitors that we would like to see in the real life. So what we did is to build an economic model. And the purpose of this economic model is to extrapolate clinical trial outcomes beyond time horizon of the study, and also to be able to incorporate all treatment arms that we potentially want to see. The first thing that a clinician will tell to us is, these models, I don't trust these models. So the first step, as recommended by the American Diabetes Association guidelines, is to validate these models. And this task is actually very, very nice, because what we do is we pick up 4 major clinical trials in diabetes, namely the ASPEN, the ADVANCE, and the 2 ACCORD studies. And we say, if we are able to put in our model the same baseline characteristics and the same treatment effects, and we are actually able to represent or to replicate with our model the findings that those authors see after clinical study end, then our model will be valid. And furthermore, what we also did is comparing the outcomes of our model between other 8 diabetes models.
And what did you find?
Well, we are very thrilled with the outcomes. What we found is that we were able to replicate 18 endpoints, micro and macrovascular endpoints. We used the correlation of the coefficient of correlation to do so. And by running the coefficient of correlation, we were able to see that we perform very well in predicting all endpoints, and especially well macrovascular complications occurring in the long term.
Now, what would you say to an ordinary diabetologist in your local town about your study? What does this mean for them?
Exactly. So for the future, we see many potential applications for this study. Especially since I already mentioned, making a prospective diabetic study is very expensive. So the first finding of this model is we are able to run hypothetical situations. We are also able to prognose beyond time horizon the micro and macrovascular endpoints of any diabetic study. And we can furthermore make lots of savings by using our model as perhaps an early assessment, or perhaps to run some hypothetical situations.
Well, thanks very much. Well, that's a very important study. And what it tells me, first of all, is that if you have children, you should persuade them to be health economists. There's far too few of them in the world, and we all need them. But seriously, you will find that very important poster on EASD.org.